Imagine for a moment, you're not feeling your best. Maybe you're even in a new country, and you're trying, really trying, to explain how you feel to a doctor. You know the right words can make all the difference, but sometimes they just, well, they aren't there. It's more than just frustrating, right? That gap can actually impact the care you get. So today, we're doing a deep dive into the world of medical vocabulary. We're specifically looking at words to help you clearly explain what's going on in your body and also understand what doctors and nurses are telling you. We've drawn on some great sources like Cambridge English for Nursing and Thinking in English, plus insights into how patients and doctors communicate. Our goal here is basically to give you a shortcut to feeling confident with these terms.
And it's fascinating, isn't it? Because describing your symptoms accurately, it's just so vital. It leads to the right diagnosis, the right treatment. Misunderstandings, maybe because of language or just not knowing the specific word, they can really affect how happy you are with your care and even your safety. This is about giving you that power to articulate what you're experiencing.
That's a really key point. It saves time, too, I imagine, in the doctor's office.
Definitely.
Okay, so let's unpack this. We want to give you practical vocabulary, clear examples you can actually use. #TagChanJoin, describing your general health and common ailments. Right, let's start with the basics then. How do we even talk about just feeling well, or maybe not so well? Seems simple, but I guess there's more to it than sick.
Absolutely. There's a bit of nuance. We often distinguish between health, which is your sort of general state, and illness or sickness, which refers to a specific disease. So you might say you're in good health, generally, or maybe in poor health if you've been unwell for a while. Healthy usually means you resist illness well.
Okay,
And fit tends to imply being strong and physically active. You could be healthy, but maybe not very fit, you know?
right, or the other way around sometimes.
Exactly. So you might hear, my general health is very good. Or perhaps, I've been in poor health for months. For someone strong and rarely ill, you'd say, she's very healthy and fit.
Yeah.
And if you're just feeling a bit off, common ways to say it are unwell, poorly, or simply not well. Just general terms for not feeling right.
Got it. So that covers the overall picture. But what about those everyday things like, when you catch a cold? How do we get specific there?
Yeah, for common ailments, we have specific symptom words. With a cold, for instance, you might have a runny nose, or maybe it's blocked, a stuffy nose, and you'll probably sneeze a lot.
Hmm.
You could also get a sore throat where it hurts to swallow. Feeling chills is common too, that shivering can't get warm feeling.
Right.
And if your temperature is high, say 39 or 40 degrees Celsius, that's a fever. Other common feelings are being dizzy, like the room is spinning, or nauseated, that sick to your stomach feeling like you might vomit.
Okay, that's helpful. And then hopefully you start feeling better. What's the language for recovery, for being on the mend?
Right. When you're getting back to normal, we say you've recovered or you're improving. A doctor might note the patient made a full recovery. The opposite, if things get worse, is deteriorating. So his condition deteriorated rapidly means it got worse quickly.
Okay.
And if you get better but then get sick again, that's called a relapse, you might just say someone got over the illness very quickly. There's also a really important word, especially for serious conditions like cancer, which is remission. That means the signs and symptoms have disappeared.
Remission. Got it. Right, so knowing how you feel is one piece, but knowing where you feel it is just as vital, isn't it? Let's talk about body parts.
Oh, absolutely fundamental. Knowing the names helps everyone understand exactly where the issue is. We have common names for external parts, things like jaw, neck, shoulder, armpit, elbow, wrist, thigh, calf, shin. Easy to point to. So
Right.
you could say, my leg is aching after yesterday's run. Simple. Or, I had a pain in my neck after falling asleep on the bus. Very specific.
Makes sense. And what about inside the body, organs and things?
Yes, internally we talk about the major organs like the heart, lungs, liver, kidneys, stomach. For the digestive system, you'll hear bowel or intestine. Sometimes, a bit more informally, a doctor might even use the term back passage when referring to the anus and rectum area. Having these terms really helps you describe internal pain much more clearly.
Okay, so you know what's wrong and where, but then who do you actually talk to? The healthcare system can seem like a maze sometimes. Who are the different specialists?
That's a great question. Knowing who does what is key. Often your first stop is your GP, the general practitioner, your family doctor.
Okay, the GP.
If it's your eyes needing glasses, perhaps you see an optometrist. Skin problems, that's a dermatologist.
Dermatologist.
Heart issues go to a cardiologist. Child health is handled by a pediatrician. Mental health concerns, a psychiatrist. And if you need surgery, an operation that's performed by a surgeon, it's also useful to know the difference between symptoms, that's what you feel, and report.
What I tell them.
Exactly. And signs, which are the objective things the doctor finds when they examine you.
Ah, okay. So an example might be he needs glasses, so the optometrist.
Gave him a prescription. Perfect. Or she's pregnant and sees the obstetrician every month. That highlights the specialist for pregnancy.
This brings us to something everyone experiences but can be really hard to describe accurately. Pain. Just saying it hurts doesn't really capture it, does it?
Not at all. And being specific about pain is so important for getting the right diagnosis. Hurt and pain are just too general.
So how can we be more precise?
Well, let's break it down. For simple descriptions, the verb hurt works fine, like my ankle hurts, or describing an action, it hurts to walk. The adjective painful is also really common. My neck is painful. And you can localize it using have a pain in, like I had a pain in my neck.
Okay, basic localization. What about how bad it is? Severity.
Right, severity is key. If it's quite bad, you'd say it's severe or intense, like I had a severe stomach ache last week. If it's really bad, extreme pain, you use words like excruciating or agonizing. Someone suffering intensely is in agony.
Wow, strong words.
They are. You might say, I got stung by a bullet ant in Brazil. It was excruciating. Or a doctor might note, the patient was clearly in agony before we gave him pain medication.
Okay, that paints a clear picture. So besides severity, what about the timing? Is it always there? Does it come and go?
Yes, timing is another crucial dimension. If the pain doesn't stop, it's continuous pain or constant pain. If it stops and starts, we call it intermittent pain.
Intermittent, okay.
For example, my friend used to have intermittent pain in his ears. Pain that lasts for months or years is known as chronic pain. Think that man suffers from chronic back pain.
Right, chronic is long-term.
Exactly, and that's treated differently from acute pain, which is sudden and usually severe, like he had an acute pain in his chest. There's also nagging pain that's more for a persistent low-level discomfort, maybe like a nagging pain in your knee that just won't go away.
Okay, constant, intermittent, chronic, acute, nagging.
Yeah.
Lots of options there.
Right.
But what about the type of pain, the actual sensation?
Ah, yes, the quality or type of pain. This is where it can get really descriptive. An ache is that continuous, unpleasant, but usually not overwhelming pain. We often combine it with body parts, stomach ache, toothache, headache. You can also use ache as a verb. My legs are aching.
Like a dull pain.
Often, yes. Then there's cramp, that sudden, sharp, painful tightening in a muscle. Common after exercise or maybe with period pain. A gnawing pain feels like something is constantly, gnawing or chewing away inside. It's persistent and irritating.
Unpleasant.
Very. A burning pain feels hot. Think indigestion, a skin rash, maybe even nerve pain sometimes. Sharp pain is sudden, intense, immediate, often the first thing you feel after an injury.
Like a knife. Or is that different?
Close. Sharp is sudden and strong. Shooting pains are also sudden and severe, but they travel, they move through the body. Often linked to nerve issues like back or neck problems. He gets shooting pains up his spine. Then you have stabbing pain that's very sudden, feels like a knife, often in one specific spot. It's frequently associated with chest pain, which is why it's taken seriously.
Stabbing. Okay, sharp, shooting, stabbing. Got it.
Any others?
Yes. Splitting is usually used for a very severe headache. A splitting headache feels like your head might burst. If an area is tender, it means it's sore or painful, specifically when touched. Your arm after an injection is often tender.
Tender to the touch.
Precisely.
Yeah.
And finally, throbbing pain. This feels like it's pulsating, beating in time with your pulse, rising and falling. Common with headaches or toothaches.
Wow. Okay, so putting it together.
Yeah.
You could say something like, when I fell, I felt a sharp pain in my ankle for a second. Then it started to ache and throb. Exactly. Or she had a throbbing pain in her neck and the whole area felt very tender when I touched it. See how much clearer that is than just my neck hurts?
Definitely. That's incredibly useful.
Mm-hmm.
Okay, so you've managed to describe your symptoms precisely using all these great words. What usually happens next? You'll probably encounter terms about medication and treatment, right?
Yes, that's the logical next step. Typically, the doctor will write you a prescription for medicine. That's the official order.
The prescription.
You take that to a pharmacy. That's the place you get the medicine. And the professional there who prepares it and advises you is the pharmacist. So I went to the pharmacy to pick up my prescription.
Okay, prescription, pharmacy, pharmacist. What about the medicine itself?
Several key terms there. Dosage is really important. That's the specific amount you need to take, like 2 pills twice a day.
Um,
Then you have the instructions how to take it, maybe with food or on an empty stomach. You always need to be aware of potential side effects.
Side effects, right. The unwanted stuff.
Exactly. Things like drowsiness, feeling tired, or maybe feeling nauseated. Always check the label on the packaging, and crucially, the expiry date.
Good point. Expired medicine is no good.
Definitely not. And it helps to know the difference between prescription drugs, which need that doctor's order, and non-prescription or over-the-counter drugs, things like aspirin or basic cold remedies you can buy yourself.
Got it. Over-the-counter versus prescription.
Yeah.
And what if it's more serious? Maybe surgery is needed.
If you need an operation, sometimes called a procedure that's performed by a surgeon, it usually happens in an operating theater or operating room. They work under sterile conditions to prevent infection. You'll hear about the incision, which is the cut the surgeon makes.
The incision, okay.
Afterwards, the wound might be closed with sutures, which most people call stitches, and then it's often covered with a dressing to keep it clean.
Sutures or stitches and a dressing.
Okay. So you might hear, he needs an operation, so his family doctor will refer him to a surgeon. Understanding these terms helps you follow along with what's happening.
So we've covered a lot of ground, a lot of specific words. But let's zoom out. What does this all really mean for you, the listener? Why is knowing this vocabulary so important?
That's really the core question, isn't it? Why does this matter? It's fundamentally about empowering you. When communication between a patient and doctor is effective, it leads to so many good things. Most importantly, it helps ensure an accurate diagnosis and the correct treatment. Think about it, if you can clearly explain that sharp, intermittent pain versus a dull, constant ache, the doctor is already much further ahead.
Save time, less guesswork.
Exactly. And studies show that good communication directly improves your satisfaction with your care. It builds trust. On the flip side, language barriers, whether it's actual different languages, confusing medical jargon, or even just difficulty understanding, these are real problems. Patients often feel frustrated because they can't get their point across or they don't understand what's being said.
Yeah, that feeling of not being heard or understood is awful, especially when you're unwell.
It really is. And having low health literacy, which just means finding it hard to understand health information, can make it difficult to really participate in decisions about your own care. So connecting it all back, having this precise vocabulary, gives you the tools to clearly explain what's wrong. It helps the doctor understand you better, provide the right care, and makes you an active partner in your own health.
It's like building a better bridge between your experience and their expertise.
That's a perfect way to put it. A clearer bridge means less gets lost in translation. #shag outro.
And that brings us to the end of our deep dive into medical vocabulary. We've gone through general health terms, specific body parts, really dug into the nuances of describing pain, and covered the language around medicines and treatments.
We genuinely hope this has given you a more effective toolkit for talking about your health. Remember that clarity and communication really can make a huge difference to your whole healthcare experience.
So here's a final thought to take away. Think about how using these words doesn't just help your doctor. It truly puts you more in control of your own health journey. The more accurately you can describe what you're feeling, the better you can advocate for yourself and make sure you're getting the best possible care. So keep learning, keep asking questions, and don't hesitate to speak up.